group of panel members here, but we really want to make this an open discussion. But I've got these friends of mine on the screen here to kick this off, to sort of tell you a little bit about how we decided to come up with this discussion today and really kick things off. So first off, it's great to see you, Jennifer and Ginger and Christy. And I'll tell you how this discussion came about is I was doing some brainstorming with Ginger and Christy, because they have recently launched a new business. And they I think they said to me, we got on Zoom and they were sitting right there, and they go, Steve, we're partners and this, that, and the other. And then I started sort of brainstorming with them about outreach for their new business to the LGBTQ community. And the reason that I did this, I'm just tell one more story and then I'm gonna turn it over to y'all. But thanks to Jennifer, I have a much better awareness of LGBT issues. And I was talking to one of my neighbors who's gay, and I apologize if I'm not using the right terminology, but she and her partner developed dementia, and I bumped into her, and she was in the hospital, and she was dealing with a lot of different issues and thinking about memory care communities and this, that, and the other. And I said, she goes, I'm at my wit's end. And I said, it sounds like you could really use an aging life care manager. And I explained to her what an aging life care manager was. And she sort of just kind of like, yeah, oh, okay, yeah, that sounds good. And then I said, and I'm not sure if she's on yet, but there's an aging life care manager, Karen McPhail, who started a nonprofit called Aging Rainbows. And I said, there's an aging life care manager that started a nonprofit for LGBT elders. And she goes, oh, give me her phone number. Like, it was sort of like I had presented this aging life care, but once I said that there was somebody who was sensitive to LGBT issues, she lit up. And that's kind of the genesis of the brainstorming that I had with Ginger and Christy. And I said, we've done some talks on LGBT elders, but I think it would be fun and probably better served if we, instead of having an agenda, let's just have an open discussion. And so with that, let's kick this off with first, let's get to know all of you, and here, let's start with Jennifer, because Jennifer, I mean, you are recently graduated from the senior living world, but
Yeah.
really made a commitment to educating me and many others on topics of LGBT elder. So maybe tell us a little bit about your background, and then we'll learn more about Christy and Ginger. And then I want the audience to know that we really want this to be an open dialogue, and there's some of you in the audience have tons of great resources, and we want to give you an opportunity to share those.
Hi, Stephen, and good to see you, Christy and Ginger. I'm very happy to be part of this panel this afternoon. I don't want to spend too much time on first person singular I. I did just graduate, as Steve pointed out. I have been retired since June of last year. I spent 50 years in the healthcare industry in all pieces of it: acute care, subacute care, long-term care, memory care, assisted living. The last 22 years of my professional career I spent exclusively in the older adult space. I'm a 74-year-old queer adult, older adult, and I have been active in different aspects of advocacy and events and programming and lecturing since the mid 80s. It's been a bit sporadic, on and off since that time. But I come out of the queer adult community, and I try to link the bridge between what we might say is vanilla older adult services and care. Vanilla is not the right word, but to bring forward certain issues in regards to cultural sensitivity, awareness, and understanding where is the client coming from? What is the lived experience of a queer older adult that was born in the 30s or the 40s, possibly the 20s, but there are less of the 20 folks around, but certainly people that were born in the 30s or the 40s have lived through an enormous change in queer culture since they were kids. And I think that as professionals in the older adult space, having understanding, awareness, sensitivity, and competency in this space in regards to queer older adults will help advance your business, and I think is an important contribution. I use the word queer. That is not a slang. That's not a derogatory term. In language, queer people, especially queer people born in the 20s and the 30s, were subject to very vile slang that was used to categorize queer older adults. And I always think it's important to reclaim language. And I think queer is perceived by the queer community to be a positive statement, an affirming statement, not a derogatory statement. That said, every time we say LGBTQ plus I, it's a mouthful. So I'm not being disrespectful to anyone. I use it generically, and it covers the waterfront. Okay?
Yep.
Thank you very much.
Great. Thank you, Jennifer. And see, this is exactly what I love is somebody, Joy says, the use of the word queer may turn some of us off. FYI, even with your explanation, I don't find it affirming at all. That's, guys, this is the type of discussion that I want to have around this topic because everybody should be sharing viewpoints, so, and everybody's has a right to their own opinions, right, Tim? Okay, so, okay. What is, Laura asks, what is the word I? What is the letter I? LGBTQI. What is that inclusive?
I'll pass that to my friends.
Oh, okay.
Yeah,
right,
I think that
Ginger and Christy, tell us a little bit about your story, and I've got your business, your website all loaded up too. But tell us a little bit about yourselves, and then we'll just start having an open dialogue.
Yeah, for sure. So Steve, always good to see you, and Jennifer, it's been a long time, so it's good to see your face again. Absolutely. So I'm Christy Kennedy, and Ginger and I are a couple. We've been married now for 30 years. And in the fall of this past year, we actually launched Silver Bridges Consulting, which is our, it's really a consulting placement company where we are truly advocates for seniors. So thank you, Steve. So this is our website, silverbridgesconsulting.com, if you want to take a look at more about what we do. But we really purpose-built this company to truly be advocates for seniors and their families. And we wanted to build this so we are the antithesis of some of the national placement companies, like a Place for Mom, that just basically give folks a list of communities to go and look at, but aren't spearheading this with them and really being that guide and that expert in helping them find the right fit for them. So we are super excited to have launched this. And as Steve said earlier, it was kind of an epiphany for Ginger and I, because when we were talking to Steve, and I've known Steve for a long time, about our new company, asking him what he thought about the model, he said, well, have you ever really considered going and approaching as a niche the whole LGBTQ community? And for both of us, it was just sort of this V8 moment of, oh my gosh, it's right in front of us. And we've always lived our life so out that it just didn't really occur to us. But it's something now that we're really focused on. And Steve, again, I just thank you for that, helping us see the forest for the trees. So,
yeah, well, and again, again, because I'm not a member of the LGBTQ community, but I want to have empathy for all folks, whether and an understanding for all folks. I see I have just one person I want to shout out to is Dan, who's here, but I noticed the word Latino, I think, and I was sort of like, well, I'll never be Latino, but I want to understand and have empathy and use the correct language and be respectful. Jennifer, you got your hand raised.
Okay, well, I want to I didn't mean to just punt that, guys. I want to answer the question. So the a standard definition of LGBTQIA plus, which I said is a lot, lesbian, gay, bisexual, transgender, queer, intersex, and asexual, with the additional plus stands for all other identities not encompassed in the acronym. Okay.
That is a mouthful.
So the Q, sometimes it has been referred to as questioning. I acknowledge that has been used as part of the acronym of folks that are exploring and questioning their personal journey. But I tend to lean in a little bit more on the term queer. But
yeah, So this is great. Okay. Well, I really so I got an email from I've got several emails from folks about this discussion today. Now, a couple of things here is that we did one of these open discussions last month on solo aging, and I set it up like a Zoom meeting where everybody could have their screen and it's easy to open up your mics. And I thought about it, and I was sort of like, well, we don't have as big. There's not 100 people in this meeting. We can certainly do that. But what we can do here is we can, if you want to be on the screen, you can. Well, actually, before I do this, I'm gonna allow Suzanne to talk because Suzanne has her hand raised. Okay, so Suzanne, do you have a question or did you want to say something? Because I'm about to tell everybody, if you want to be on the screen, just raise your hand, and then I'll open up your camera and mic. So Suzanne, if you had something to say or ask, just open up your mic there, and then you can do that. And then the other person, before we kind of open things up, that I would love to have say a few words is Dan Stewart. So Dan, here I'm gonna open up your mic and camera because Dan emailed me earlier today with just some great resources from Sage and so Dan, can you hear me?
Yes. Hi, everyone.
Here, I'm
Here we go.
make you a panelist here, and then if you want to turn on your camera, you can. And then let's see. There you go. Hey, Dan.
Hello. Hi,
All right.
everyone. Well, thank you, Steve. Thank you for the invite. And Jennifer, Ginger, Christy, really appreciate the work that you are doing on the ground. I'm Dan Stewart. I use he, him pronouns. I'm the Deputy Director of the Aging Equality Project for the Human Rights Campaign Foundation. So we're the educational arm of the country's largest LGBTQ organization. For the last 5 years or so, I've been in this role as a proud gerontologist who has started my work in the Missouri area, but now get to work nationally with senior housing providers across the country as it pertains to inclusive policies, specifically really from independent living, skilled nursing, the gamut of care. Our long-term care quality index, we just had our 2023 survey results published in May. We do that in partnership with Sage. And from that experience, had about 200 communities participate, Ingleside communities in the DC area where Ginger and Christy are located, as well as some of the Watermark properties as a national presence. We've also created a consumer guide for folks that can really walk people through the process of what questions to ask in terms of policies and practices. questions as it pertains to visitation, to non-discrimination policies. I also want to state for folks, especially as it pertains to looking for inclusive communities, that we're currently seeing some progress in terms of LGBTQ Senior Bill of Rights. In terms of legislation, DC has one, Montgomery County, Maryland has one, California, New Jersey, New York was just the last one to sign on. But essentially now we're starting to see some state protections specifically as it pertains to long-term care and senior housing and inclusive care. So hopefully we're starting to see a lot of growth in this field, and especially because of folks like Ginger, Christy, and Jennifer that are sharing their experiences, their stories, helping folks get connected. But I'll drop some resources in the chat of some links. Thank you for putting in the consumer guide there. And I'm also going to put in a link to our landing page for our LEI 2023. But we'll be releasing our survey in summer of 2024 for community to sign on and take the survey. And everything is validated, as well as ensuring that people not only have the policies, but they're actually training staff and that the residents are aware of them as well.
I love this. And thanks, Dan. And let's see. I could see us having a whole hour with you and learning about the putting the guide together and what what's going on in the communities and how the consumers. In fact, you shared this great video with me. I'll make sure to put it in there of two residents, a couple that lives at Edenwald, which is in the Baltimore area, and that's really cool.
Yeah, thanks for sharing, and thanks for the invite to share. Happy to connect with folks. So really helping to find resources.
Yeah, and just hang on the screen here, because I'm about to basically what we'll do is that I got two people with their hands raised. It looks like Suzanne, your mic is open. Can you hear me now?
Yes.
Suzanne? Yeah. Did you have a question?
So far, no.
Okay, your mic is really echoey.
Okay. Sorry about that.
Oh.
I don't have a questions, but
okay.
I'm happy to be here to listen. Yeah.
Excellent. Okay. All right. Thank you, Suzanne.
You're
Well,
welcome.
what Suzanne and Laura's hands were raised, and what I would say, folks, is that we can make this kind of like a more of a visual thing as opposed to just the four of us talking to folks. So if you would like me to promote you to panelists so that you can see, you can use your mic and your camera, by all means, just raise your little virtual hand. I think there's an icon at the bottom of the screen, and then I'll just promote you to panelist, and then we've got the ability to see and have a conversation. But at this point, I would sort of say to the folks that are on the screen, what are some topics or issues or things common themes that you seem to find in the area of LGBT elder? Maybe kind of kick it off with that, or does anybody have any challenges that they're faced with? and yeah.
Steve, I think one thing that we're seeing still is there is still quite a bit of hesitation from people that are LGBTQ when they're looking at senior living communities, with not knowing how they're going to be accepted, if people are going to discriminate against them, if they're going to feel like outcast. So as much as in 2024, we'd like to believe it's different, there's still a lot of work to be done in that. And so I think that's something that's still pretty, even in this area, I mean, it's still pretty ubiquitous.
Yeah, when I sent out my email this morning, I looked up some stats, and it's something like 20% of people feel like they might be discriminated against, and they are hesitant about going into healthcare settings. And yeah, we feel like the world is very inclusive, but there's obviously still a fair amount of hesitation out there. So
and there are a lot of negative consequences to that hesitancy to seek healthcare, because healthcare then delayed is healthcare that becomes more complicated. healthcare that is indirect in terms of communication or candor can have a detrimental effect on the relationship between the provider and the queer older adult. I think that the right now, and I know, Steve, we don't want to get down that rabbit hole of the politics, but the current climate is not healthy. And the current climate, we live in a little bit of a bubble here in the DMV, but the current climate across the country is in parts of the country very antagonistic, not just towards LGBTQ people, but the T people, and to be specific. And the T people are easy targets, but it's more broad-based. It's the Florida Don't Say Gay legislation. It's bathroom legislation. It's book banning and pulling books out of libraries. So even though the T folks kind of get the brunt of the barrage, the fallout to all older adults and younger people is that the gains that were made following Stonewall, following the efforts to get marriage equality, following the efforts to get equality in our lives, are backsliding. And folks that, as I said, were born in the 20s or the 30s, they lived through some nightmares. And they got on the other side of those nightmares and they could breathe. Well, now that breathing is becoming more difficult. So as providers, the onus is kind of on us to establish rapport, trust, honesty, candor, and try to establish a level of comfort so you can have honest communication.
Well said. Yeah.
Yeah. Dan, your program is sort of, maybe get into a little bit in terms of what does it take to for a community to be regarded as I don't want to use the wrong terminology, but I think you have, like you had said, that Ingleside is a recognized organization, what a distinctive organization. Tell us a little bit about what that looks like, because this may be a model for all of us to think about.
Well, what we consider foundational to an inclusive community really starts with the non-discrimination policies. As Jennifer was speaking to, we really have a patchwork as it comes to across our nation. Unlike our hospital systems that have particular legislation that has necessitated protections, we don't really see the same thing as it pertains to skilled nursing, assisted living, independent living across the board. So really ensuring that the community has that written in place, not just for the residents, but also the staff. We're seeing many staff who identify as LGBTQ who perhaps have also had to stay in the closet as they work in these institutions, unaware that they work in a safe environment. But because it's not written down as a protective policy, it doesn't guarantee those job protections that many folks are looking at. And then lastly, in terms of the visitors as well, it's important to recognize that as LGBTQ people, we're more likely to be caregivers. So caregiving for peer-to-peer, as well as adult children, where we're seeing folks looking for communities where they themselves may not, they may feel welcomed as a straight person, but their adult child who's a member of the LGBTQ community isn't. So really ensuring that those are policies in place. Training is a big piece of it as well. Because the policy without training is kind of the faith is nothing without the acts to really bring to life. And not just having them on the books again, but communicating. Does your website have it? Does your brochures have this information? Are we really being upfront? And in light of the hesitancy, I will say I've been doing this work for the last 12 years. And initially 12 years ago, people would be saying, oh, what are you talking about LGBTQ elders? We don't have any LGBTQ elders here. I think people just thought we like exploded in a puff of glitter at the age of 60, but somehow we've survived and we are here. And I think it is promising with things like the LEI, with institutions that are, national presence that are actively taking on initiatives to be more inclusive, to really recognize that when we say person-centered care, we really mean creating an environment where people feel safe to bring their full personhood. And that includes LGBTQ folks.
So it's these organizations, it's not just like one staff that went to a certified training. It's a top
It's a
level
full
leadership,
comprehensive,
which makes a lot of
inclusive of the
sense
workplace as
because
well.
yeah, if I'm working in a community and let's say that I take a class and what have you, if I go to another community, it's like, but if the leadership and everything that makes a lot of sense.
And I will say real quick, Steve, in terms of the longevity of this project, this is the second year that we'll be doing this survey, but we've been doing this with the hospitals for about 16 years, with about 1,000 hospitals across the country, and our corporate equality index with the Apple, Nike, Peloton, all those folks participating in for the last 20 years. So really, this is kind of our first foray, although about 10 years in the making of actually launching it to where the industry feels ready to really have these conversations. I also just want to point, Laura, I know you had your hand up and wanted to say something and haven't been able to, so just wanted to catch that.
Thank you so much. I actually didn't really want to, I just wanted to say, I work with the Alzheimer's Association, and we are really interested. Well, let me just go back to the part about, we're in a horrible moment now where things that had been fought for are no longer, available. And I can tell you that because Alzheimer's and dementia are diseases for which there have not been cures, doctors have been very reticent to discuss these diagnoses with their patients. And I was at a meeting last week where an elderly white gentleman in McLean went to his doctor. His doctor sort of muffled his diagnosis and said that it was now time he had to leave. And the person got 0. And I said, I would almost expect that if that were me, or anybody of color. But I'm sort of surprised that that's still happening for elderly white men. And it is so difficult to get. We don't even have a shortage of neurologists, but I welcome the opportunity to be in touch further because we are trying to identify and help people know who are good, neurologists and where are safe communities. And I'm really delighted to hear about all the work you are doing, having also worked in the in-home care industry. And even as, a straight white woman, I would not really see myself in those environments. So I applaud the work that you are doing and look forward to telling people about what you're doing.
Great. Thank you for joining us. Somebody asked, and I see Dan is typing some response there too, and Melissa, I'll get to you in a second. And they say, are the challenges of elder care for this community similar to those of elder orphans, which we have stopped using the elder orphan term and we like to call it solo aging? There are some similarities, I think, in that there's the solo agers have started to form a community where they're helping each other. And if you haven't seen this film, it's called Gen Silent. That made a huge impact on me in terms of seeing some of the challenges that, oh gosh, yeah, these are some of the stars of of this documentary. But it really, elder care challenges, it's challenging enough. But if you're nervous about, somebody, I think in the film they said praying the gay out of you in a nursing home, then that makes it even more challenging. So, anyways, hopefully that was a response there. And Dan, I'll cut and paste Dan's response there. Melissa, yeah.
Yeah, so I'm the Director of Education and Support at Insight Memory Care Center. And I just wanted to share, and it goes in with what you guys were saying, that there's a huge issue with isolation and going back in the closet. And we're very much aware of that here at our day center. And being the director of education, one of the key things for me coming into this role 2 years ago was to diversify and make sure I'm getting to those populations that need the most support. And so obviously going into the queer community was really important to me. And so conveniently, we have Dr. Carrie Candrian speaking for us on the 14th, and it's a hybrid class. I'm going to put the link in for everybody, but she's talking about isolation in the queer community for us. And so she's lovely, and I want to make sure that everyone is a part of that. We also have, for those of you who don't know, an LGBTQ dementia caregiver support group virtually online, the third Wednesday in the evening every month, who's run by Dawn Jefferson, who's a pastor in Alexandria. It's part of the queer community, and both her parents had Alzheimer's, so she's a great resource for us as well. But we had an 8-series blog that was written by one of our families going through this journey in the queer community, and other things that we have provided. We partnered with we did Gen Silent with Jennifer. We've also partnered with some authors and so forth. So we really want to make sure that the resources are out there, and I'm open to getting more suggestions and pieces. We're also working with a couple of people to get resources up on our website as well, and some other opportunities. So just thank you guys for the work that you're doing, and we want to continue to be a part of that.
Oh, I love it. And yeah, today I saw Melissa put up I shared it on there. It's who's in your circle, who's in your circle. We'll look at the importance of creating social circles in the LGBT community. And I think Melissa, like, this intersects exactly with what the person asked, is the challenges of a elder orphans, solo agers, and LGBT are often kind of similar, as creating that village of support around you.
Yeah, and it's hard. I've known couples that have been together for years, and I was doing care management during COVID and moved someone into a community, and the staff group saying, "Oh, her sister," and they weren't saying it in front of her. And I immediately stopped them in the tracks, and I said, "This is her wife. She's been with her for 38 years. You need to acknowledge that." And they had SAGE training, but it doesn't always get across to people and realize the impact that can have on somebody by not saying the right things. And so I think it's really important that we just keep doing the teaching piece. I mean, after saying it a couple times, they stopped and they were acknowledging it and recognizing it, and everything was fine, but it took someone stopping it in its tracks and addressing it.
Yeah, and that's the hard thing, is when you hear any ageism or discrimination, sexism, racism, what have you, it's correcting it. Most of the time people are saying things by accident. It's not malicious. I found, at least. Okay, Laura's got a great question. Would love to get your thoughts on if you perceive the community villages to be LGBT friendly. And for those of you who aren't familiar with the villages, I'll drop the link in, but this is the Village to Village network, and there are these grassroots community villages nationwide that help people with aging in place solutions. Any thoughts on the villages? I know a few villages in the DC metro area really have tons of programming supporting LGBTQ. Anybody?
Yeah, Steve, it is kind of village to village in terms of how proactive they are about engaging with queer older adults, and sometimes it's geography. DuPont Circle, Capitol Hill. There are villages that are in the middle of large gay populations, and the village couldn't function if it didn't have active gay programming. And then there are some villages, I don't know, I'm not saying it's deliberate, but their view of their membership, their view of their volunteers, their view of their village isn't necessarily outside of a fairly straight aging population. So I don't think you can point to the village and say they're very supportive or they're not. It really is at the individual level. And the other question that was posed earlier about the parallels between solo aging and queer older adults aging, I guess I'll go back to the village analogy. It varies from family to family. There are queer older adults that have very solid families of choice and solid relationships with families of birth. And then there are other queer older adults, and they've got nobody. And that nobody, their partner may have passed, or they may have ended a relationship years ago and they don't have a new partner. And they are out on a limb by themselves. And that's where, as Melissa was pointing out, that social isolation becomes very critical, and where the challenges of solo aging parallel some of the challenges of queer older adults that do not have networks of support.
And let's see, yeah, Joy is saying Silver Spring Village has LGBTQ group that meets times per month, some on Zoom, some in person. Yeah, I think it's one of these things, but the cool thing is that the more villages are, and the more senior living communities and providers are organizing support groups and this, that, and the other, the more that this is what you have to do to operate in this space, is that you have to offer these services. Okay, let's see. Any other topics or questions or things that are out there? For those of you who've seen Jen Silent, one of the things that always touches me when I watched it was a transgender woman who, or and again, a person who's transgender who was sick and had no family to care for her, and the groundswell support from the LGBT community, like, it was very touching, and ultimately the support was there, but in the film she sort of pushes it away eventually. But I think it just speaks to the fact that we can all build our personal village, but it does take a little bit of effort, like in whether we're solo aging or just aging in general. There's a lot of people out there that want to help. But it's hard to ask for help, right? Okay, well, I tell you, like, this has been great. Again, folks, this is an experiment. I wanted to just sort of address this topic using our platform on the community, and I would love to continue this. I really would. I think, Dan, I can see one thing that I could see as being a good follow-up to this is doing a discussion where maybe we have some of the couples, like the one that you featured at Edenwald, individuals who live in communities, and hear firsthand, how they made the choice and what it means to live in the community that they live in.
Yeah, most definitely, Steve. I thank you for uplifting this topic and having the conversation. I think a big challenge that we all have is the invisibility that has existed for so long within an infrastructure that has its own challenges. But definitely we're seeing some more positive momentum within the industry, really recognizing that, LGBTQ people are part of the community, part of the folks that they work with, part of the residents that they serve, as well as the families that are visiting. And so, try to use that momentum again to encourage, as we were saying, not just the training piece, but the policy and the upholding those policies as well.
Mm-hmm. Let's see. I dropped. Kirsten is talking about Seabury Resources Out and About program. I dropped that into chat. So that's a great program. And Jennifer, that's your alumni. That's before you graduated.
I'm very, very happy to see Kirsten on the webinar. Yes, Kirsten was a former program director for the Out and About, which is specifically, it's a DC-based program that is focused on addressing social isolation amongst queer older adults. It's unfortunately pretty limited to the District of Columbia, so it really isn't in Maryland or Virginia, and it is part of Seabury Resources for Aging. Iona Senior Services, also based in DC, has an active outreach and programming and support groups for queer older adults. So Iona is a good resource. The resources then will vary a little bit in Northern Virginia and in Montgomery and Prince George's County. They're not all equally invested. Maybe that's the polite way to put it. And but the issue is, as Melissa was touching on, social isolation is terrible for any older person, and it becomes a little more challenging maybe for queer older adults because they've been isolated a lot through the course of their lives. And this is another step into isolation, which can be very emotionally difficult.
I love Bonnie. Everybody can read Bonnie's comments, and she talks about the senior living community that she lives in and what they're doing and the groups that are meeting and some of the discrimination and things that we've heard here. She reflects on that. Bonnie, if we do another discussion, would love to have you come on because I love sort of the first person perspective. And then Laura asks, would love to know from Christy and Ginger if they have found many friendly places in this community to age. And obviously, don't call out anybody that you found unfriendly, but what have you discovered as you have started your business and been out there?
Definitely, there are many places that we found to be gay friendly and not have issues. One of the most important part about our process is being able to represent our clients in this case and to have those proactive conversations with communities because they're not going to make our recommendation list if they don't have that covered. And so to that end, really excited about the number of communities that are in fact very supportive, friendly, certainly constant education. In some cases, you may find, I say constant, there may be parts, right, where whether it be a caregiver, et cetera, who may use the wrong pronoun or not recognize a wife, et cetera, but always an openness as well for the education, wanting to ensure that, in fact, all caregivers are very aware what to say, not to say, how it's said. So a real thumbs up in the area, and happy to, if anyone would like more information, just reach out to us. Happy to have those discussions about what we're seeing.
So out of curiosity, and this is for Ginger and Dan and anybody on the screen, but like when I talk to families about finding a senior living community, I often say like the best thing to do is make a list of everything that you're interested in about your personality, your hobbies now and in the future. And, you know, and when you go in, even before you go in to marketing, present them with this list and say, when I visit there, I would love to meet people that you think I might get along with. Have you found that in communities that the residents are amenable and open about being gay and would be welcoming to like a prospective resident to have lunch and kind of talk to them about the community? Have you seen that's pretty standard practice?
Yeah.
Yeah, we've certainly seen that people are open to it. I think there is, I think there's still a lot of work to do, even on the move-in paperwork, the form side of the house, where they're asking about certain things. There's no mention of pronouns. There's no mention of a number of things that really be put in place around these issues. And if it says married, people are going to think if I'm a woman, if I'm married to a man. So there's no distinction of that's in there. So I think there is a lot of work still to do on that front, just to really embed this more in the cultures within senior living communities. But I think at least the appetite is there and it's changing.
Yeah.
Wow. Just thinking about all the forms that I fill out, is there sort of an updated version to forms? Like how, I haven't even done research on this, but my thought as you just brought it up is that married and and I don't know what terminology you would use. Dan, you might, in your research, you may be more well aware of this, like including on your intake forms, how do you ask people to identify, and couldn't that also be, make somebody nervous by answering a question like that?
No, we definitely have seen increase, especially in the hospital sector and the electronic medical records, of more add-ons in terms of inclusion of pronouns, preferred name. I always like to say, you know, the information that we gather here, typically at the front end and on the forums, can be a great way to, you know, have these conversations or a sense of who someone is beforehand. I mean, my legal name is Daniel, but I like to go by Dan, and just to that person-centered care again of these are kind of best practices of just to get to know everyone. But in terms of sexual orientation and gender identity and actively asking those questions, we are seeing more inclusion of that, especially in national research and things of that sort, especially in terms of you have to count in order, you know, to be counted, you know, have to be able to count you, and using that information. Hesitancy is understandable, but again, the preface of we're using this as a way to best know our residents and get to know you. We ask everyone this question. You feel free to not respond if you don't want to. But just even that small preface is enough for folks to understand why you're asking, which is enough for people then to feel comfortable to answer, especially when we take in consideration the generation of folks who lived during a time of you know, legally losing their jobs through the military if they were identified as LGBTQ, or thought to be a threat to democracy through the McCarthy era. So thinking about, you know, the lifespan perspective of folks that are carrying these experiences with them, the context and the information is important. And, you know, as Christy said, I think there is a hunger for it, and we're seeing more from both the provider and the consumer side.
Yeah, and I think it's important too that people know how that information is going to be used. You know, who is that going to be made available to? Because I think not disclosing that up front leaves people very cautious to fill that out, just as Dan's saying. So that's certainly a conversation that needs to be brought to bear as well.
And Molly has a question for Ginger and Christy, but for everybody, do you find that there are queer couples retiring together in senior living communities? I work
Yes.
in senior living, but on the corporate side, and I'm intrigued by your comments as something as simple as form fills.
Yeah, definitely we're seeing that, which is a wonderful thing. And great, in a recent where one partner is suffering from dementia and the other's not, right? And wanting to be together in their own apartment, being able to get services that are appropriate for each, and working out really, really well. So absolutely, yeah, we're seeing that. I guess there's another question. I don't know if there was not, or if anyone else has.
Oh yeah, no. Well, Joy was saying Ingleside has several couples that I'm aware of, and I guess Dan, I've been in this business for 35 years, and as I saw some of the questions here, it reminds me of there was a tremendous push by civil rights groups for fair advertising, okay, meaning back in, you know, the 90s, where folks had to have, you know, the equal housing logo on their ads, and they had to show all different ethnic backgrounds in their advertising, and if they didn't do that, they were fined. And a lot of the senior living communities said to me, it's like, man, you know, we have to hire, we don't have any, you know, African American or Asian residents. We've got all white residents here, and so we have to hire models or use stock photos to abide by this. Out of curiosity, with the certification, are you able to do it like cart before the horse? In other words, I want this community to be LGBT. I want, you know, gay couples and individuals to come to this community. And I'm going to prepare my staff for that, but we don't have any right now. Is that you can do both? It's not a requirement that you have gay couples living in your community.
Right. And I think it's also safe to assume that you may have had gay couples that just never said anything and been serving them for years. You know, there's been a historical hesitancy in relation to this topic, concerns about what will residents think, what will staff think. And I often see, with organizations that have taken it as a full-on mission-based initiative. Most of the communities that participate in the long-term care quality index are nonprofits, are small communities. We provide a menu of about 40 best practices, but it's a menu of options, recognizing that what works in, Little Rock may not work in Houston, or what works in Denver, it works perfectly as well in Wisconsin. And we're also able to, to connect these providers together to get a better sense. I will say, though, we have heard of challenges where there may be a community where someone is very excited and wants to show their support, but then they experience backlash. And without the policies in place, without staff, the leadership showing a dedication to and understanding as to why we're doing this, I think there can be some difficulties when folks, kind of show their welcoming mat without actually doing any of the work inside to clean up and ensure that it's prepared for those guests to enter. So, it's important to show that inclusion, but again, I say first and foremost, just make sure you have an inclusive non-discrimination policy with sexual orientation and gender identity, because currently you can go from one state to the next and have no protections. And if you can do that internally, it's a way that we can then hold folks accountable in terms of how we interact with one another.
Wow, man. This is great information, and I see that we burned through an hour, and I hope you all appreciate this. I mean, I felt like if we just did something that was kind of wide open, that some themes might fall, and I think Dan and his program is one big theme that we can carry on with, bringing this community together on this platform, and so. For anybody who's on the screen or not, we got a few minutes. If you all have any sort of closing thoughts or things that you feel should be discussed that weren't discussed in this hour, feel free to jump in. Okay.
I'm just going to throw something in the chat really quick. Just a resource, the National Resource Center on LGBTQ Aging, that link that I just put in essentially kind of houses anything and everything you could think about in terms of resources as it pertains to health and services and support of this population. Go ahead, Melissa.
I'd also be curious, Dan, if you have data. So I do a presentation on older adults and depression and suicide rate. And a lot of people don't realize that the older adults have the highest suicide rate because we hear about the young adults. And I'd be curious, I've not found any data where, it subdivides different cultures, but it does not subdivide different genders. And so, or the genders, but not the queer community. I'd be curious what those numbers are. And I don't know if you have access to that. I'd love to be able to add that to my presentation as well.
Yeah, there's some kind of small research that I can follow up. And Melissa, I have your email because I get so you got me on that.
I got
but
you.
I think that's a very important topic. I mean, just even anecdotally speaking with folks that work with older LGBTQ folks, especially our transgender individuals, are really struggling to see a healthy, happy aging. And I think it's important to recognize that we really did lose a generation of aging LGBTQ folks because of the HIV/AIDS epidemic. So there's also reasons why we're just now kind of figuring this all out together. But I appreciate you bringing that topic, and I'll loop back around with some resources. Not as much research as we need. Again, going to asking those questions about sexual orientation and gender identity. But we're learning more every day, and should have some more stuff out soon.
Great. All right, folks. Well, this has been great. Enjoy the rest of the week. I want to thank everybody who's on screen and everybody who's in the audience listening and participating. This was wonderful, and I hope it's just a first step that the positive aging community can do towards creating awareness and making the world a better place for everybody. So, all right. Okay. Enjoy the rest of your day. And
Okay,
thank you.
great seeing you, Jennifer, too.